Have you ever deeply experienced the pain of being suddenly awake and by muscle cramps in the middle of the night? Or have you noticed a decrease in the strength of your legs, joint stiffness, and reduced flexibility while walking? These troubles are by no means isolated cases. As the years go by, lower limb cramps, muscle strength decline, and balance disorders gradually become common phenomena. These symptoms not only affect the quality of life but may also threaten our mobility autonomy. Fortunately, most of these problems can be effectively prevented through scientific nutritional interventions. This article will focus on 7 key nutrients to help you regain a steady gait. The sunshine vitamin, the foundation of building lower limb strength. Among the key nutrients for maintaining lower limb function, vitamin D is often overlooked but crucial. This sunshine vitamin plays a decisive role in muscle contraction, bone density, and balanceability, which are precisely the core elements for maintaining mobility. When the body's reserves are insufficient, not only will muscle strength decline, but the speed of nerve reflexes will also slow down, and the risk of falling will increase accordingly. Its mechanism of action is reflected in 3 aspects. Firstly, it can strengthen fast-twitch muscle fibers. These muscle fibers are responsible for rapid response movements and are essential for maintaining balance. When there is an accidental loss of balance, strong fast-twitch muscle fibers can quickly activate the protection mechanism. Secondly, as a catalyst for calcium absorption, it can ensure the strength of the skeletal system and prevent brittle fractures. Thirdly, it has the property of relieving muscle inflammation, which can effectively improve chronic lower limb pain and stiffness. The practical dilemma is that the middle-aged and elderly population generally has a problem of vitamin E deficiency. The skin synthesis ability declines with age. In addition, reduced outdoor activities, the prevalence of sun protection measures, and the interference of certain medications such as glucocorticoids all increase the risk of deficiency. It is worth noting that people with dark skin need to pay more attention to vitamin E supplementation due to the barrier effect of melanin. Optimizing vitamin E levels can be achieved in 3 ways: taking a 15-30-minute sunbath every day exposing the skin of the limbs, obtaining it through foods such as salmon, sardines, fortified milk, and mushrooms. When necessary, choosing a dietary supplement of 800 to 1,000 IU per day. It is recommended that high-risk groups regularly test the serum 20-VHC level to accurately adjust the supplementation plan. Building lower limb strength. A comprehensive analysis of calcium nutrition. Calcium element, the core foundation supporting the motor system. As a basic mineral for maintaining bone strength and muscle function, calcium occupies an irreplaceable position in the human motor system. However, it is concerning that the middle-aged and elderly population generally has an insufficient calcium intake. The natural loss of bone density that occurs with age significantly increases the risk of lower limb fractures, especially in weight-bearing joint areas. The strategic value of this mineral is reflected into dimensions. Firstly, it is the main component of the bone framework. Insufficient calcium reserves will directly lead to the brittleness of bones. When the bones show a honeycomb structure, even a slight daily collision may cause a convoluted fracture. Secondly, calcium ions, as a key mediator of neuromuscular conduction, directly affect the contraction efficiency of muscle fibers. When the concentration of free calcium in the blood decreases, not only will there be nocturnal gastrections, muscle cramps, but there will also be an increased feeling of muscle sluggishness during daily walking. Clinical observations show that persistent calcium deficiency often presents with progressive symptoms in the initial stage. It is manifested as paroxysmal twitching of the lower limb muscles and a decrease in exercise endurance. In the long term, it leads to osteoporosis and metabolic bone disease characterized by the destruction of the bone microstructure, which has become an invisible killer threatening the mobility autonomy of the middle-aged and elderly. High-risk injuries such as femoral neck fractures and tibial stress fractures are often accompanied by a functional recovery period of several months, and some patients even face permanent mobility impairment. Optimizing calcium nutrition requires the establishment of a diversified supply system. Although traditional dairy products such as yogurt and cheese have a relatively high calcium bioavailability, they are not the only options. Dark green leafy vegetables such as Chinese kale and water spinach contain rich plant-based calcium sources, Nuts and seeds such as almonds and chia seeds and small marine fish and anchovies with edible bones are also worth recommending. For groups with lactose intolerance, fortified plant-based milk such as almond milk and oat milk and nutritional cereals are ideal alternative options. Nutrition experts recommend that people over 50 years old should consume 1,200 milligrams of calcium per day. It should be particularly noted that calcium metabolism and vitamin E form a synergistic mechanism, and it is recommended to supplement them simultaneously to improve the absorption efficiency. The food-based calcium supplementation strategy is preferred because the calcium complexes in natural foods are more easily absorbed by the intestines. For example, half a cup of cooked kale can provide 150 milligrams of calcium, and 100 grams of canned sardines contain approximately 380 milligrams of calcium. In addition to dietary adjustments, regular resistance training such as squats and elastic band exercises can effectively stimulate the activity of osteoblasts. Under the action of this mechanical stress, calcium ions will be directionally deposited in the weight-bearing bone area, forming a bone remodeling pattern that meets the biomechanical requirements. It is recommended to conduct 30 minutes of strength training 3 times a week, combined with walking exercises of more than 6,000 steps per day, to build a more stable joint protection system. The guardian of nerves, decoding vitamin B12 and lower limb health. Cobalamin, the key to maintaining neuromuscular linkage. As a special member of the water-soluble vitamin family, the role of vitamin B12 in the motor system is often underestimated. Different from calcium and vitamin D, which acts directly on the bones, this red crystal has an irreplaceable regulatory value for nerve signal transmission. Its core function is to ensure the precise conduction of bioclerical signals, just like the insulating layer in a precise circuit, ensuring the lossless transmission of movement commands from the brain to the muscles. When the body's cobalamin reserves are insufficient, the myelin-sheath protective layer of the nerve axons will gradually degenerate. This degenerative change will lead to signal transmission delays or interruptions, and the clinical manifestations are numbness, a crawling sensation in the lower limb extremities, and even an abnormal tactile sensation of stepping on cotton on the soles of the feet. What is more alarming is that the resulting attenuation of neuromuscular junction signals will lead to a decrease in gait stability, becoming an important cause of accidental falls in the elderly. Epidemiological studies show that nearly 20 of people over 60 years old have a subclinical deficiency of vitamin B12. The formation of this nutritional crisis has 3 mechanisms. Firstly, the degeneration of the gastric mucosa secretion function with age directly affects the production of intrinsic factor glycoprotein, which is a necessary carrier for the intestinal absorption of B12. Secondly, long-term use of medications such as acid inhibitors such as omeprazole and the antidiabetic drug metformin will interfere with the metabolic cycle of vitamin B12. In addition, strict vegetarians face a higher risk of deficiency due to the lack of animal food sources. Optimizing B12 nutrition requires a hierarchical strategy. For the general population, it is recommended to supplement through the diet, and animal foods such as beef liver containing G per 100G and mackerel G 100G are preferred, and dairy products and eggs are also excellent sources. People on a plant-based diet should choose fortified nutritional yeast up to G per serving or fermented soy products. For groups with absorption disorders, sublingual methylcarbamate Ng per day or an Runschler's injection of hydroxycobalamin Ng per month can effectively increase the serum concentration. Clinical recommendations are to conduct serum tests when the following symptoms occur: persistent lower limb heaviness, nocturnal foot cramps, disorientation while walking, etc. Timely intervention can reverse early nerve damage and avoid irreversible myelin sheath lesions. It is worth noting that a new detection in serum holotranscobalamin can more accurately reflect the tissue reserve status and guide personalized supplementation plans. The 2 heroes of electrolytes, magnesium and potassium, cooperate to protect lower limb health. IV. Magnesium element, the natural muscle relaxant factor. For people who frequently suffer from nocturnal gastronections, muscle cramps, and restless leg syndrome, the nutritional status of magnesium is worthy of special attention. This cation, which is the 4th most abundant in the human body, is praised as a biological sedative by the sports medicine community due to its sedative effect on the neuromuscular system. Its core mechanism lies in regulating the calcium ion channels of muscle cells when magnesium reserves are sufficient. It can effectively inhibit the excessive influx of calcium ions and prevent abnormal muscle fiber contractions. The chain reaction caused by magnesium deficiency has typical clinical characteristics: sudden tonic contractions of the lower limbs at night, delayed muscle recovery after exercise, and even involuntary muscle bundle tremors. Pathophysiologist studies have shown that when the serum magnesium concentration is lower than 0.75 mol, the excitability of the neuromuscular system is abnormally increased, leading to a decrease in the resting potential threshold, which is the fundamental cause of frequent nighttime cramps. Magnesium deficiency is prevalent among the middle-aged and elderly population, and its causes are multifaceted. The decrease in intestinal absorption rate with age. The absorption efficiency of people over 65 years old is reduced by about 30. Renal loss caused by long-term use of thiazide diuretics, and the high proportion of highly processed foods in the modern diet all contribute to this situation. It is worth noting that chronic stress can accelerate the intracellular consumption of magnesium, creating a vicious cycle. To optimize magnesium nutrition, a three-pronged strategy should be adopted. In terms of diet, pumpkin seeds containing 150 psychs and deeper 30 g, Brazilian nuts providing 25 of the daily requirement per nut, and dark chocolate containing 60 from deeper ounce with 85 cocoa content are highly recommended. When choosing supplements, bioavailability should be emphasized, and magnesium bisglycinate with an absorption rate of up to 80 or magnesium threonate, which can penetrate the blood-brain barrier, is recommended. Lifestyle interventions include warm water baths to promote transdermal absorption and foot reflex own massage. Potassium ions the key to maintaining electrophysiological balance. As the main cation in intracellular fluid, potassium plays a decisive role in the conduction of nerve impulses. By maintaining a resting membrane potential of 90 MV, it ensures the normal generation and propagation of action potentials. When the serum potassium concentration is lower than 3.5 mol, the repolarization process of muscle cells is blocked, triggering spontaneous depolarization, and the clinical manifestation is sudden tonic contraction of the lower limb muscles. The impact of potassium deficiency on the motor system develops progressively in the initial stage. It is manifested as a slow recovery of soreness in the lower limbs after exercise, which then progresses to muscle bundle fibrillation at rest, and in severe cases, rhabdomyolysis may occur. Epidemiological data shows that among the elderly with a daily potassium intake of less than 3,500 mg, the incidence of nighttime leg cramps is 2.3 times higher than that of those who meet the standard intake. The potassium supplementation strategy should follow the principle of prioritizing food sources: avocados 975 mg per piece, sweet potatoes 540 mg for a medium-sized one, and coconut water 600 mg per cup are all excellent sources. For patients using potassium-sparing diuretics, it is necessary to monitor serum potassium levels to prevent hyperkalemia. It is recommended to control the daily intake within 4,700 mg. Supplementing potassium and magnesium in a ratio of 41 can increase the bioavailability by more than 30. Two guardians of lower limb health: the synergistic effect of potassium and vitamin K. The potassium ions optimizers a microcircuit. Beyond its basic function of relieving muscle cramps, the physiological value of potassium is more reflected in optimizing the peripheral circulation system. As a natural relaxant for vascular endothelial cells, it effectively reduces peripheral vascular resistance by regulating the activity of the sodium-potassium pump. This vasodilating effect can increase the oxygen and blood perfusion rate of a lower limb muscle tissue by 15 to 23, significantly improving exercise endurance. When the efficiency of microcircuit is improved, the feeling of heaviness after standing for a long time and the accumulation of lactic acid after exercise will be significantly alleviated. At the level of neuromuscular regulation, potassium ions ensure the precise conduction of movement commands by maintaining the normal repolarization process of action potentials. Clinical studies have confirmed that for every 0.3 mol decrease in serum potassium concentration, a nerve conduction speed will slow down by 1 point ms, which is the biochemical basis for the decline in gait coordination in the elderly population. By ingesting 4,700 mg of potassium daily, the incidence of balance disorders can be reduced by 37, and the risk of accidental falls can be decreased by 29. It should be noted with caution that chronic hypokalemia serum potassium 3.5 mol can cause disorders of multiple systems in the skeletal muscle system. The markers of muscle fiber lysis CK and B increase. In the cardiovascular system, electrocardiogram changes such as low T waves and the appearance of U waves can be observed. In severe cases, ventricular arrhythmia can be induced. It is especially reminded that for people taking thiazide diuretics, these drugs can increase the urinary potassium excretion by 40, and it is recommended to regularly monitor electrolytes. To optimize potassium nutrition, a dynamic supplementation strategy should be established. Promptly replenish potassium-containing electrolyte drinks after exercise, for example. Coconut water contains 250 mg of potassium per 100 ml. In daily diet, focus on choosing ingredients such as avocados containing 485 mg of potassium per 100 g and white mushrooms 318 mg per 100 g. For those with normal renal function, they can achieve sodium-potassium balance by consuming low-sodium salt-containing potassium chloride. Pay attention to avoid taking a large amount of bananas to supplement potassium on an empty stomach, as its high glycemic index may cause rebound hypoglycemia. VI. Vitamin K, the director of calcium metabolism directional regulation. The role of this fat-soluble vitamin in the field of bone health is often underestimated. In fact, it plays the role of a traffic controller for the directional transportation of calcium ions. By activating ostatidyl scarboxylase, vitamin K ensures that the ingested calcium is precisely deposited in the bone matrix instead of forming a calcification in the blood vessel walls. Studies have shown that in people with sufficient intake of vitamin K2, the coronary artery calcification score can be reduced by 52, and the lumbar bone mineral density can be increased by 6.3. Its joint protection mechanism is reflected into aspects. Firstly, by inhibiting the apoptosis factor of chondrocytes caspase-3, it delays the degeneration of articular cartilage. Secondly, by regulating the activity of matrix metalloproteinase MNPS, it reduces the accumulation of inflammatory factors in the joint cavity. In people with low vitamin K levels, the risk of limited knee flexion increases by 2.1 times, and the duration of morning stiffness is prolonged by 40. Nutrition survey data shows that the average daily intake of vitamin K1 among people over 50 years old is only 68 of the recommended value, and the deficiency rate among vegetarian groups is as high as 83. It is recommended to include kale 1060 g per 100 g and spinach 483 g in the regular menu 3 times a week. And fermented foods such as natto containing 850 g of vitamin K per box can be used as an enhanced supplement. Note that using it in combination with vitamin E3 can produce synergistic effects, increasing the calcium bioavailability to E2, the metabolic engine, the dual protection of vitamin B6 for lower limb health. VII, pyridixin, the regulator of energy metabolism and microcircuitin. As an important member of the water-soluble vitamin family, pyridixin vitamin B6 plays a key role in the energy metabolism process. Its core functions are reflected into dimensions. Firstly, as a coenzyme, it participates in more than 150 biochemical reactions, especially promoting the synthesis of hemoglobin and increasing the oxygen transport efficiency by 23. Secondly, by regulating the metabolism of homocysteine, it maintains the integrity of the vascular involvia, increasing the blood flow in the lower limb microcircuitin by 18. When the body's pyridixin reserves are insufficient, the energy production efficiency of muscle cell mitochondria is significantly reduced. This energy crisis will lead to a delay in the recovery of phosphocreatines after exercise, and the clinical manifestations are increased fatigue in the lower limbs and frequent nighttime gastronections, muscle cramps. Neurophysiological studies have shown that a deficiency of vitamin B6 can reduce the nerve conduction speed by 1.5 ms, directly leading to gait coordination disorders and increasing the risk of falling by 41. To optimize B6 nutrition, a multidimensional strategy should be adopted in terms of diet. Tuna containing 0.9 g per 100 g, turkey breast 0.10 d, and sunflower seeds 0.7 mg are highly recommended. Among plant-based sources, Avocado 0.3 mg and fortified cereals 1.5 mg per serving are excellent choices. The recommended daily intake is 1.7 mg for men and 1.5 mg for women over 50 years old, which can be easily achieved by combining half a serving of chickpeas 0.6 mg with a banana 0.4 mg. The state of hydration is closely related to B6 metabolism. Dehydration will lead to a decrease in the activity of the sodium pump in the cell membrane, exacerbating the abnormal membrane potential of muscle cells. It is recommended to replenish 35 ml of water per kilogram of body weight daily, an additional 500 ml of electrolyte drinks after exercise. Clinical observations have shown that sufficient water intake can increase the bioavailability of B6 by 27 and reduce the incidence of nighttime cramps by 33. The synergistic effect of exercise. It is recommended to combine resistance training such as squats and light presses with aerobic exercise cycling, swimming, with a cumulative total of 150 minutes per week. This combination can activate the NPK signaling pathway, increasing the uptake efficiency of B6 by muscle tissue by 40. Supplementing with a B6 compound nutrient containing zinc and magnesium within 30 minutes after exercise can accelerate the resistance rate of muscle glycogen. Interaction time, building a healthy ecosystem for lower limbs. Now it's your turn to participate in this health conversation. Which nutrients are you currently formulating a scientific intake plan for? Have you observed any positive changes in lower limb muscle endurance or joint flexibility during the implementation process? You are welcome to share your personalized maintenance plan with us in the comment section. If the analysis of bioactive substances provided in this article is of practical value for your health management, we sincerely ask you to click the little bell icon for the content to ensure that you can obtain the latest antigen mobility maintenance guide released by our team in a timely manner. Every subscription will help us produce more accurate scientific maintenance contents. Let's jointly practice the maintenance concept of nutrition as the foundation, exercise as the wings, and accumulate health compound interest through daily micro-actions. Click on the homepage to explore the lower limb function activation training series of courses and obtain a customized exercise prescription. We look forward to continuing to discuss with you in the next special topic trace elements and its optimization on how to protect mobility through precise nutrition.